Today, we're diving into something huge. The state of health in America. Our main source here is a pretty detailed recent interview with the current Secretary of Health and Human Services.
Right. So it's a firsthand look at, the administration's thinking, their priorities, their plans for health.
So the mission for you listening, let's pull out the big takeaways, maybe some stats that make you go, huh? And just get a clearer sense of where things stand with American health right now.
Okay, so where do we start? His background seems unusual for this role.
It really is. Not your typical politician's path. He spent, what, 40 years as an environmental lawyer?
Yeah, 4 decades. And a lot of that time with Waterkeeper. The group focus on clean water globally.
So, environmental law. How does someone pivot from that to running HHS? What was the trigger? Seems like a big jump.
It was. According to the interview, his focus really shifted to health after he got concerned about thimerosal.
The mercury preservative in some vaccines?
Exactly. He published an article back in 2005, and that seems to have been the turning point, pulling him deeper into these health issues.
And this wasn't about, like, climbing the political ladder.
Apparently not. He actually called it maybe the worst career choice he could have made. He talked about significant personal and professional hits.
Really? Like what?
Lost friendships, family strains, all because of his stance on these health topics. So it definitely suggests it's driven by conviction, not ambition.
Oh, okay, interesting. So someone deeply invested personally is now shaping policy. How does he actually see the state of American healthcare? Because, it often feels like we spend a fortune.
And don't get what we pay for. That's exactly the point he makes. He laid out this really stark contrast.
Which is...
The U.S. spends like 2 to 3 times more on healthcare than any other developed nation.
Yeah.
2 to 3 times.
Oh, okay.
But our health outcomes, near the bottom. Worst in many cases. He mentioned higher rates of chronic disease, highest COVID death rate among developed countries. It's not a good picture.
That spending versus outcome thing is just staggering. Did he share any specific stats that really, jump out?
Oh, yeah. Several pretty worrying ones, like today's teenagers. Their testosterone levels are, on average, a half those of men aged 60 to 68.
Half? That's alarming.
And sperm counts. Same story, half of what older generations had. Girls hitting puberty much earlier. Rising infertility.
And wasn't there something about military readiness?
Yes, a huge number. 74% of young people today don't qualify for military service, mostly due to health reasons. That's a national security issue right there.
74%. Good grief. Did he compare our spending to any specific countries doing maybe better?
He used Indonesia. It was a striking comparison. They spend about $3,300 per person a year on health.
Okay.
Their average lifespan, 84 years. Now, compare that to the U.S. We spend around $12,000 per person.
4 times as much, almost.
Right. And our average lifespan, 79 years. Lower. He also pointed out that we used to track with Europe on life expectancy, but they've gained 6 years while we've basically flatlined.
So way more money, worse results. What about the economic side of all this chronic disease?
It's crushing the economy.
Yeah.
He said something like 95%, 95 of our healthcare spending now goes to treating chronic illness.
95%. That seems incredibly high.
It is. And think about the change over time. He mentioned during his uncle's presidency, chronic disease prevalence was maybe 3%. Now, it's 60%.
60.
That's an explosion. And it means healthcare costs are just climbing year after year faster than the economy grows, about 2% faster. It's unsustainable.
Did he give that example about the furniture maker that really stuck with me?
Yes. The Wisconsin Furniture Company. They said even with tariffs, they couldn't bring manufacturing back from, say, Vietnam.
Why?
Why? Because the cost of healthcare for just one American worker equaled the entire salary of a worker overseas.
Wow. That just puts it in perspective, doesn't it? How much this impacts competitiveness.
Absolutely. It's a major burden on businesses.
Okay, so the picture is pretty grim. What's being done to figure out why? Especially with kids getting sicker? What are the root causes?
Well, the interview highlighted this thing called the MAHA Commission. It was set up by executive order specifically to study the childhood chronic disease epidemic.
MAHA Commission. Okay. What kinds of things are they looking at?
It's a broad list. Diet, obviously. Toxic exposures, things kids absorb, medical treatments themselves, lifestyle factors, environmental stuff.
Right, pollution.
Yeah, and also things like government policies, how food is produced, even electromagnetic radiation, and then corporate influence, cronyism. It's a wide net.
Okay, let's zoom in on diet. That seems like a big one. What were the main points there?
Huge focus. He talked about the sheer number of ingredients allowed in U.S. food versus Europe. It's something like 10,000 here compared to only 400 there.
10,000 versus 400. That's incredible.
And a lot of what's allowed here is actually banned over there. Food dyes were a specific example.
Right, the colors in processed foods.
Exactly. He announced a plan to get rid of petroleum-based synthetic dyes within 2 years. He even pointed out how Kellogg's uses vegetable dyes in Fruit Loops sold in Canada and Europe,
But not here.
but chemical dyes in the U.S. version. Same company, different ingredients depending on the country.
Why? Is it just cheaper?
That's a big part of it, yeah. Synthetic dyes are cheaper, and they often make colors brighter, more appealing, especially to kids. But he also raised a really disturbing point
What was that?
about tobacco companies buying up food companies years ago.
Big tobacco moving into big food.
Right. And then applying all the science they developed about addiction
Yeah.
to food,
Oh.
engineering food to make us crave more. Super high sugar, high sodium. Using artificial flavors that taste like real food but don't have the nutrients. He called it creating an itch you can't scratch.
An itch you can't scratch, meaning your body keeps wanting something it's not getting.
Exactly. You eat, but you're not truly satisfied nutritionally, so you keep eating. Plus, he mentioned food softeners.
Softeners, how do they fit in?
They reduce chewing. And chewing is actually a signal to your brain that you're getting full.
Ah, okay. So less chewing, less feeling full.
Right. You can eat more before your brain catches up. And then on top of all that, you have pesticides, other residues. He put it bluntly, like literally eating poison.
This sounds a lot like that idea of high versus low response cost foods we've talked about before. The easier it is to eat, the less your body registers it.
Precisely. And sugar is just central to all of this. The amount we eat now compared to, say, a couple hundred years ago, it's just exploded.
And the consequences. Diabetes.
Massive spike. He said when he was young, a pediatrician might see one case of juvenile diabetes in their whole career. Now, almost 40% of teenagers are pre-diabetic or diabetic.
40%.
And it's not just us. He mentioned China adopting Western fast food, and now over half their adult population is diabetic or pre-diabetic.
Okay, this all seems pretty obvious in a way. Less poison, less sugar, more real food. Why is it so hard to change things? Why the resistance?
Oh, he pointed fingers directly at the industries making money off this stuff.
The processed food industry, big pharma.
Exactly. Their influence is enormous, lobbying Congress, pouring money into advertising, which gives them huge leverage over the media.
He told that story about Roger Ailes at Fox News, didn't he?
Yeah, it was pretty revealing. Ailes apparently agreed with the points in a documentary about vaccine safety concerns.
But wouldn't air it.
Couldn't air it, he said, because pharma companies were like 75% of their evening ad revenue. So the money talks, and it can silence certain messages.
And it's not just what doesn't get aired, right? He talked about active censorship, too, his own experience.
Right. Getting kicked off Instagram during COVID for supposedly spreading misinformation, even though he said he cited everything.
And the lawsuit.
Yeah, the lawsuit against the Biden administration. It apparently showed the White House was actively pushing social media platforms to censor him and others. He gave credit to Elon Musk for releasing files from Twitter that kind of blew the lid off that.
Okay, let's switch gears a bit. There's a measles outbreak happening now. How did he address that, especially given his history with vaccine topics?
He acknowledged it, yeah. Said it's the second biggest outbreak since 2000. Cases, some deaths. Did a quick comparison. Canada has similar case numbers, but a smaller population. Europe has way more cases.
Did he talk about the MMR vaccine?
He did. Said it was highly effective, helped nearly wipe out measles for a while. But he also talked about immunity wearing off over time, waning immunity.
So even vaccinated people can get it.
Yeah, he said outbreaks are mainly in unvaccinated groups, but vaccinated people can still get sick. He mentioned this idea of a leaky vaccine.
Leaky vaccine, what does that mean?
It's a vaccine that protects the person who got it from getting really sick, but might not stop them from getting infected entirely or from spreading it. He credited that term to Sir Graham Wilson, an expert from back when the measles shot was new.
Were there safety questions raised about the MMR specifically, the combined shot?
Yes. He pointed out that the 3-in-1 MMR vaccine, as a combo, never went through pre-licensing safety trials against a placebo.
Really? They just assumed.
The assumption was if the individual measles, mumps, rubella shots were safe alone, the mix would be safe too. But he raised concerns about potential viral interference, maybe a higher risk of side effects compared to giving them separately.
And the Merck lawsuit?
He mentioned that whistleblower case against Merck about the mumps part of the vaccine, alleging they fudged the efficacy data. The case got dismissed on a technicality, but the allegations were serious.
So, With all that said, what's the official recommendation now?
He was clear. HHS still recommends the MMR vaccine. They see it as the best tool to prevent measles and stop outbreaks, but they are doing more research.
Okay. And what about tracking side effects? He mentioned VA-EARS, the reporting system.
Right, the Vaccine Adverse Event Reporting System.
Mm.
He stressed that most vaccines, except for the COVID ones, didn't have that pre-licensing placebo testing. And VA-EARS itself has limitations.
How so?
He cited a 2010 study, the Lazarus study, that estimated VA-EARS probably captures less than 1% of actual vaccine injuries. Less than 1%.
So most potential issues aren't even being reported.
That's the implication. So they're trying to reform VA-EARS to get a much better, more accurate picture. And reinforcing, informed consent, the whole doctor-patient conversation.
Let's move to another big health issue.
Yeah.
Autism. He's putting significant money into research there. Why the urgency?
He basically called it an epidemic. The numbers are just staggering. He went through the history. 1 in 10,000 kids back in 1970.
Okay, very rare.
Then one in maybe 3 or 4 per 10,000 in the mid-'80s by 2020.
Oh.
1 in 36.
Wow.
And yet now, he said the latest is 1 in 31 overall. Higher in places like California, 1 in 20. And for boys, maybe 1 in 12 and a half. It's a massive increase. And the economic cost is huge, too.
He got some flack for comments about profound autism. Right. Can you clarify what he meant?
Yeah, he addressed that. Said he was specifically talking about the most severely affected individuals nonverbal, needing help with basic functions like toileting. He felt his words were twisted to sound like he was dismissing all people with autism.
But his point was
that this specific severe form represents a devastating loss of potential, and that parents of kids with profound autism actually reached out to thank him for finally acknowledging their reality.
And he linked the rise back to the idea of epidemics needing environmental triggers.
Exactly. He argued epidemics aren't usually just genetic. Genes might make someone susceptible, but you usually need an environmental hit to trigger something on this scale.
So they're looking for that trigger.
That's the goal. He mentioned EPA data from 1989 possibly marking the start of the steep climb. And that consistent 4-to-1 ratio, boys to girls, is seen as a major clue. Maybe something toxic affecting mitochondria, the cell's energy production.
Okay, the interview covered a lot of other ground, too. Let's do a quick round on some specifics. Food dyes, any update?
Just reiterated the plan.
Yeah.
Get the petroleum-based synthetic ones out within 2 years.
PFAS, the forever chemicals.
Big concern. He talked about his environmental law background, fighting these. Acknowledged it's tough because EPA is the main regulator, but he's working on it. The problem is companies can just tweak the molecules slightly to get around bans.
AI fakes. That fake video with Bill Maher?
Yeah, he used that as an example of how dangerous AI can be for spreading completely false, damaging stuff. Showed him saying horrible things he never said.
Drug ads on TV, direct-to-consumer advertising.
He called it a huge mistake. Wants to find ways to end it. Pointed out how weird it is we taxpayers often subsidize these drugs, and then the companies get tax deductions for advertising them back to us.
COVID vaccine for babies on the CDC schedule.
Said there are ongoing discussions. He sounded skeptical about the justification, mentioning limited safety data for that age group and the low risk kids face from COVID itself.
What about reining in big pharma? The revolving door.
Definitely on the radar.
Yeah.
He talked about stopping regulators from jumping straight to industry jobs. Also tackling conflicts of interest on the panels that actually approve drugs.
Microplastics. Nanoplastics. We hear more about those now.
Expressed serious concern. Mentioned studies finding them in human organs, even the brain. Said research is ongoing into how they might mess with hormones or cause cancer.
Holding companies accountable for harmful stuff.
Acknowledged it's hard. Said you need solid science first before you can really go after them legally or with regulations.
Medical freedom. Mandates.
Repeated his support for medical freedom. Said mandates are largely up to the states, but the key is giving people good, solid information to make their own choices.
Stratospheric aerosol injections. Chemtrails.
Flat out said his agency isn't doing that. Pointed fingers, maybe, at DARPA, the military research arm, or possibly jet fuel additives, but said he'd look into it.
Any timeline for getting toxins out of food or the environment?
The plan seems to be analyze ingredients, publish the science on what's harmful, then push companies to remove it, or at least label it clearly so people know.
And ADHD. Other neurodevelopmental issues.
Confirmed they're part of the broader study into what's driving these childhood health trends.
Okay, so wrapping up this deep dive. It's clear there's a ton on the plate, huge health challenges, some really ambitious plans to tackle them.
Yeah, and the thread running through it all, at least based on the interview, is this commitment to following the science, being transparent.
Definitely seems to be the stated goal. Evidence-based decisions.
Right.
So as you listening think about all this, maybe consider what it means for you, for society. Could be a nudge to, I don't know, read food labels differently next time you shop.
Or maybe have a different kind of conversation with your doctor about vaccines or other health concerns.
Exactly. Just something to chew on.